Welcome back to Life on Purpose, a show that highlights the lived experience of real people, just as opposed to not real people. Life on Purpose is brought to you by a unique partnership between Asheville FM 103.3 and Sunrise Community for Recovery and Wellness. Sunrise Community for Recovery and Wellness is a nonprofit staffed entirely by certified peer support specialists who utilize their lived experience to provide authentic peer support, resource navigation, and education to individuals struggling with trauma that often leads to substance use and mental health issues. You can find out more at www.sunriseinasheville.org. That's sunriseinasheville, one word, .org. So please keep in mind that the views and opinions expressed are those of the individuals on this show, including me, and do not directly reflect Sunrise or Asheville FM as a whole. Our issues may overlap a bit, but again, I'm not speaking for anyone. And my guest, Michael Harney from WNCAP, can speak whatever he wants.
Hey.
Hey. Let's jump in, because again, this 50 minutes just goes really fast. And I don't want to sound impersonal, but let's cut to it. This is a two-pronged question, but let me start off with the second half of this. How did you get involved in this work?
So the work you're talking about is kind of multi-layered, I guess.
Mm-hmm.
So I call myself Michael Harney. I always introduce myself as Michael Harney. You know, people, do you know Michael somebody? I said, well, I don't know. Do I know Bill somebody? But I'm always Michael Harney.
Uh-huh.
So in 1990, this is the answer.
Uh-huh.
In 1993, I made a donation to the Western North Carolina AIDS Project. Back in those days of the HIV/AIDS kind of epidemic and pandemic, people were given 20% of proceeds to, as donations to AIDS projects. And I had been selling these, what were called freedom necklaces back then, over at Scandals. And the bar owner, his name was Art Fryer at the time, said that I needed to speak to this guy named Marty Prairie at the Western North Carolina AIDS Project. We call it WNCAP.
I didn't realize WNCAP was that old.
It's been around since 1986.
Wow.
That was when people were coming back home from the big cities, San Francisco and LA and New York and Chicago, to die here. They lived here, left for the big cities.
The lethality of HIV at the time was still ridiculous.
I mean, it was.
Yeah. Okay.
So now 1993, I got here to Asheville in 1992 from Hampton, Newport News, Virginia. And in 93, I go to make this donation, and Marty says, "Yeah, we'll take that money. That's fine, great. But is that your pickup truck out there?" And I have a 1986 Toyota pickup truck. Everybody knows it. It's 39 years old right now.
It still runs?
It still runs, and it better run for the next 15 at least. So I've had it for 38 of those years.
Wow.
But so he said, "Yeah, is that your pickup truck?" Of course it is. And can I help volunteer and do things? And would you help move this lady's furniture and sit at the Bell Share booth at the time? And I said, sure, okay. And then he said, you want a job? And I said, yeah, okay. I always like to have a job. Everybody knows I got 2 or 3 of them. I'm always afraid I'm going to get fired from one of them, so I have at least 2 others. And he said, yeah, we need you for street outreach. And I said, okay, I'll do it. What is that? I had no idea what he was talking about. So I always give Marty Prairie the credit of teaching me more about what it would be like to live with HIV or Hep C than anybody's ever been able to, and for training me as such a great mentor in all that I've ever done in the streets of Asheville, in the community of Asheville, here in this region, and in life now.
So I kind of jumped into this maybe a tad prematurely. I want to set the title or the topic of today's discussion roughly is around harm reduction, HIV management, and the history leading up to where we're at now as compared to where we were at in the Reagan era in the 80s. I had a talk with somebody last night that they didn't remember that because they're only 20 years old.
We're 44 years in the HIV epidemic now.
44.
1981 was the first 5 diagnoses of...
It brought me back to Angels in America.
Sure.
And that was a 2-parter. And there was another play right after that, began with a P, and I don't remember what it is. But I just remember the sense of dread that was associated with a death sentence at the time with HIV.
That's right. So it wasn't much longer after that in 93, so by 94, I was tripping over needles downtown. and Marty had left. He was from the Pine Ridge Indian Reservation as a young man, left and went to some of the bigger cities of California. So he saw the beginning of the epidemic. He saw all the interventions, including what are now called syringe services programs, but were then called needle exchanges. And I said to him, I said, it just seems like that's a biohazard to see needles all over the streets of downtown Asheville. So it was nothing new to me to see them back in 1994. And Marty said, yeah, we need to start a needle exchange. And I said, yeah, we do. What is that? I didn't know what he was talking about. I don't have the training in public health.
And he's a manager of a fruit and beverage place, right? I mean,
no, he was doing my job at the Western North Carolina AIDS Project.
I thought he managed scandals.
No. So the owner, Art Fryer,
there you go,
was the owner, and he knew Marty because Marty would bring condoms to scandals at that time. Wow. That was the guy that did that. So now I'm the rubber man, but he was. And that's how we got started.
Do you remember how hostile that I can remember the environment was about needle exchanges even 10 years ago? And it was like, you need to get out of town, you're enabling people, you're empowering them to use drugs with paraphernalia. Yeah. Just ridiculous.
Well, I thought back then it would take no more than 2 years really to get through the logistical, roadblocks of the state and that kind of thing. But it took 25 years before it became legalized here in the state of North Carolina.
Right.
And I will say one other thing about that is that now that we have 54 syringe service programs across the state, that's more than most states actually have.
Okay.
It was New Mexico had 22 at a time, and I'm not sure they still have those, but I'm talking about back in the 90s when you had 3 or 4 in big cities like, New York City, and there's one in San Francisco and LA and wherever. We were considered a small exchange here. If we exchanged 1,000 needles in a whole year, we thought we were pretty hot snot.
Wow.
And so it's gotten quite a bit larger than that across the state now.
It's, the enigma of North Carolina, liberal in so many ways, not in many other ways too. Right. Do you remember who was the first daring, courageous group besides WNCAP to do needle exchanges? Was it Study Collective?
So locally, but across the state there were 4. Okay. There was Brian Letourneau was the health director in Durham, and he was an advocate earlier than the needle exchange program of Asheville. So we started in 1994 and went to the state and did this whole big, it was the Minority Health Advisory Council at the time, and there must have been 50 or 60, 70 people around this huge table in Raleigh, including Ron Levine, who was the medical director at the time, the state medical director, and I think it was Secretary Howes at the time. So we met with all these people, and Marty and I had been traveling around to different exchanges across the country and brought all this information back and either complimented or contradicted everything the state said. They were saying things like, we've already got bleach kits, we don't need needle exchange. And we said, well, no, the literature shows that that's not an effective intervention. And think about it logistically and logically. You don't share needles for any reason. Right. Not for insulin, drugs, steroids, hormones, or vitamins, So yes, it was a tough time, but so there was Thelma Wright. She was who started North Carolina Harm Reduction. Okay. And she originally had what was called the Wright Focus Group, and that was in the Greensboro High Point area. You had another underground program in Winston-Salem, and then us, and we were the only openly active exchange program in the state. We were on TV with UNCTV and on the radio and in the newspapers. We just those 2 long hairs from the mountains come into Raleigh sometimes.
Trying to think, when did the North Carolina Harm Reduction Coalition come into existence?
So that would have been late 90s, operated by Thelma Wright. And then couple years later, a couple other people, you probably know the name Nabarun Dasgupta, Dr. Dasgupta Nab, we called him. He was on the board at the time, and he's become this great figure now at UNC and Chapel Hill, and involved in the drug testing that they're doing now, that kind of thing. So he's really grown into this world of harm reduction. But those were days back with Dave Purchase from the North American Syringe Exchange Network, and we would go to the NASEC conferences. And
what's NASEC?
North American Syringe Exchange Conference. Okay. It was NASEC. Okay. So NASEN was the network, the C was the conference.
Got it.
And so yes, the study, when you mentioned the study, they came much later to the table, but they were doing kind of downtown where we were fixed site at the Western North Carolina AIDS Project. they did a little bit of mobile, and they were at the Haywood Street congregation, kind of housed in there at one time. Eventually, what I was advocating for years was that every county health department, we've got 86 county health department locations in North Carolina, that each one of them, even though I've got 100 counties, but that each one of them should be a point of access. I can go in and get my vaccinations, I can get my testing, I can get condoms, I can get birth control or whatever from health departments. Why couldn't I get a simple tool to reduce HIV, hepatitis, endocarditis, and other bloodborne infections? And so the health department here finally, and in collaboration with Sunrise, operates that program here in Buncombe County. So that was an impressive, I think, move and change. There were only a couple of counties.
I'm still astounded we have an actual facility within 40 Cox Avenue. I look back and I go, that's a long way to go in a short time.
It was, yes. There are only a couple of other county health departments across the state that even operated and have over the years.
Now, having said that, I could still go down there and I'm like, do you know where the SSP is? And they're like,
what is that? Right. No. You have to be in the know. You have to be in the know.
Even in their own building. Can you talk a little bit about WNCAP and your role at WNCAP?
So the Western North Carolina AIDS Project, as I said, started in 1986. And when I came on board in 93, we were on College Street. We had a small building there. So they do case management. That's the primary job of the Western North Carolina AIDS Project, was case management for people living with HIV in the 18 counties of Western North Carolina. So as far as, Cleveland and down Polk and around Transylvania and out to Cherokee and up to Avery, this whole corner of the state, we have clients living with HIV. So that's what the case managers were there for. There was a component then created as prevention education. We call that the Prevention Education Department. And so my colleague Sam and I have an office space, and we do community education in the community to agencies like, it might be Neil Dobbins, it might be First at Blue Ridge or ADAC or Crestview and all the names, and go to jails and prisons. And I always say the hardest thing I ever have to do in a whole year is speak to the 6th, 7th, and 8th graders over at Asheville Middle School. They're a tough crowd.
Oh my goodness.
But things like that. We do that and go anywhere
wherever
they asked. I tell them they can ask any question, and I must answer it correctly. So this is their opportunity to ask.
Got it.
They oftentimes ask about
anything that
things.
kind of jar you, going like, "Well, I didn't see that coming."
Well, no, nothing can shock me. I always say, if you can shock me, I bet you I can shock you back. But are we allowed to say masturbation? That's always the question that comes up. But for students to understand about their bodies, to have self-esteem, to understand their own bodies. And sexting is another issue, how dangerous it is as a young person, and that it's against the law for them to be transmitting images, nude images of their friends, their girlfriend, boyfriends, across the internet. And they're like, what do you mean? It's just my boyfriend or girlfriend. I was like, it's illegal. Those are minors, pictures of minors that you are showing online, but they don't get it quite yet. And so, we talk about those kinds of dangers too.
Okay. What motivated you to work in this field?
I don't know. I can't explain that. The truth is, Kevin, I really can't explain why I'm here, how I got here, and what power. There was a lady in Norfolk, Virginia. I used to sell men's suits, believe it or not, for JCPenney. And I was in the mall having lunch. And at the time, I had 2 hot dogs in my hand. And this lady came up to me, and you might describe her as the most homeless looking, bedraggled, old somebody, have no idea. She came up to me and she just started talking, and she said, you'll be safe in the mountains and everything will be all right, and you'll see what I'm talking about. And I was like, yep. I said, would you like a
Here we are.
hot dog? And she was gone.
Just like that.
I'm telling you right now, I'm shiver when I say that, because I looked around in all directions. She was not there.
Wow.
It was as though she vaporized. I don't know what that was. And so later, it was a couple years later that my friend Patricia Adele, who brought me here to Asheville, asked me to come and build a garden in her new house that she had purchased and help her paint the house. And I always remember that, because I don't know what the power was, but for whatever reason, I was supposed to be here, and that's how I see things. And so, how did I get involved? Why am I involved? That's how and why. Right. But I love my job. I love this community, and it's a very supportive community. every environment I go to, I feel supported and comfortable, and it's just an amazing place to be. I don't know that it would work any place else for me.
Is there another WNCAP office up north, like in Franklin?
So we have our main office is here in Asheville. We have an office in Shelby because the case manager that works in that region, kind of the eastern part of our region. We have in Macon County in Franklin is another office space where we do mostly harm reduction services, including HIV and Hep C, and even maybe rapid syphilis testing when we have those tests. And they do all the same syringe services. And from there, they have a mobile unit that goes out to some of the outerlying counties.
How many people does that encompass between the three centers?
In terms of staff?
Yeah.
I guess it's roughly...
What's their jobs? I mean, what's their certifications to do that kind of work?
Well, they have been trained. They've got peer training, some of them. Some of them have other case management sort of training. Obviously, for testing, we need to be certified by the state to draw blood. We don't really draw blood, venous blood, but finger stick. But still, there's a testing protocol. We have to get certified to do that. And then it's the other... training, about compassion and taking care of people and knowing where the resources are. Right. Same stuff that you all train folks on. In that sense, I feel like you all do a greater training in some of the areas.
Okay.
But there's probably 20, 25 of us, I guess, total that work, and there's some, we don't call them peer navigators, so it's not to disclose any status with all the stigma still around, but navigators, community navigators.
Cool. What's your typical day look like in an atypical vocation?
Mine is exciting. That's why I love it so much, is because every day's a little bit different. I might start at 8 or 9 o'clock, and then I might have to go to one side of town or go to another county or go to a health fair or test somebody or be at the jail or prison, or so my day is exciting. And then I get to go teach Spanish at both AB Tech and the Blue Ridge Community Colleges.
I'm so
in the
jealous
evenings.
Of you. Again, that bilingual. My languages don't help in this neck of the woods, but
what do you speak?
Does Arabic and Persian, Farsi.
Exactly, that's
a little
wonderful.
bit of Afghan. That's a long time ago. It goes fast when it's not being utilized.
Right, I understand that. On Saturday mornings, I deliver food for Loving Food Resources, which is a food bank that specifically was created to provide food for people living with HIV or in home hospice care. Now they've opened that up in collaborating with Blue Ridge Pride, the overall umbrella, to serve people who are LGBTQ plus food insecure. So they're doing that as well. But I deliver food on Saturdays for them.
And you take off when? This is me talking, right?
Right. Who are you to say anything like that? I have a cup of coffee when I'm ready, and if I need to, I have a great flexibility, I say, to even take time and come over and do this today.
Very cool. Thank you.
I just decided to make that happen. It was exciting to be invited.
So here's another two-part question. What kinds of services does WNCAP provide? You mentioned some of it. And is it just for people with HIV?
No, so the case management is for people living with HIV. They have housing services. HOPWA is the Housing Opportunities for People with AIDS, was the original. Nobody says AIDS anymore. It's passé.
I know.
So, but HOPWA is the one of the funding streams from the federal government to help house people living with HIV or at the time AIDS. So there's some of that money, and we have housing case management. And then prevention education, we have a harm reduction services, and there's 5, 6, 7 people maybe that work in that. And everybody is kind of cross-trained to do HIV and hepatitis C rapid testing.
Okay.
We have volunteer services, so programs, that need an event, a tabling. Maybe we'll do a Pride event this summer, and we'll have volunteers that want to participate. They have volunteers that deliver food, and some of the navigators take some of the clients to appointments and make sure their medications their pill boxes are filled, and
cool.
Deliver food boxes to them too in the different outlying counties. So we kind of do all of that. We have a great board of directors who are very supportive. It's hard, and it's just the challenges of probably fundraising and all that. I have the best job because it's easy, it's fun. To me, I don't have to worry about writing that grant and trying to seek the money to keep the doors open. So I'm very grateful to anybody who is involved in that.
Let's talk about again, we're probably addressing an audience. I took it for granted just because of who I work with. Like, everybody knows about harm reduction, but really, what is harm reduction?
Yeah. Put your seatbelt on. That's harm reduction. You know,
Yeah.
Smoke a fewer
Condoms.
cigarettes than
Okay,
right.
harm
A
reduction.
condom's fine. Fewer cigarettes than you smoke in a day, maybe 2 fewer. That's harm reduction. So that's
Sure.
what they always argue about. It. Harm reduction is any way of reducing the damages of whatever it might be. And
Sure.
I'm not here to judge anybody because I don't want to be judged. You could judge me easily, and I don't want to be judged. So I try really hard not to seem or act or even be judgmental. Some people use drugs, and I guess all of us really do if we think about it. If you got up this morning and had a cup of coffee,
Oh, I had many.
There's a drug. If you, after work, want to have a beer or a cup of wine or something like that, people do. I am grateful to Marty because he had been through that program. He lived, as he put it, clean and sober for the last 15 years of his life. He had, found recovery and sobriety here in the mountains of Western North Carolina. So in 1995, I just felt like it was insulting to smell like alcohol, and I stopped drinking back then. That was what I decided. I always say I have no jurisdiction over your body or your decisions. You have no jurisdiction over mine. But every decision we make has a result, beneficial or consequential. What do we do to reduce harm? We make it beneficial, or do we make it consequential in the decisions we make? So, it is I guess the start of harm reduction was based in reducing HIV and then in what was called non-A, non-B hepatitis, but hepatitis infections. That was the start of it, that people had access to safer injection equipment and now safer smoking equipment. And now if you don't smoke or inject, maybe you snort, or if you don't, maybe you absorb some other which way. And so all the ways to reduce whatever harms that you may be exposed to in any measure of that.
Did you get pushback on providing like glass stuff for people, like pipes in lieu of syringes being safer?
It was never part of the deal of the legislation that glass was, the pipes and stuff to smoke whatever people smoke. So that wasn't part of the paraphernalia because that wasn't really endangering law enforcement. So the reason behind the legislation was not so much to provide services to people using drugs as much as to protect law enforcement who might be encountering people who are using needles. To make sure that if you had a needle in your pocket or your purse or under your seat or in the trunk, that you say to the law enforcement, there's a needle there, be careful. It was all...
Who came up with that narrative?
North Carolina Harm Reduction Coalition had to somewhat compromise with legislators because Thelma and I and Marty, all those years, we tried with different legislators to pass. There was a Representative Wise, used to be a very big supporter from way out east, and he could never get the traction to pass the legislation just to make it legalized that all pharmacies have to provide a needle no matter what. None of these games about what is it for, who's it for, insulin, what kind of insulin, how much, all that, instead of saying for no reason should somebody use a needle behind him. I've never been to the health department where the nurse dug in her sharps container and pulled out a needle from yesterday and said, I only used it 4 or 5 times. Are you ready for your vaccination? I'd be like, no, I want to see you open a brand new needle.
Right.
And so we stigmatize people who are trying. That was the other thing. People were always stigmatized. They're just using needles and drugs and all this kind of stuff, instead of seeing that people actually wanted to use a new needle. They wanted to dispose of it properly, but we couldn't seem to get kiosks here downtown. That was a big to-do about having kiosks. If you go over to the Kuala boundary and go up and down the road there, they've got these big red kiosks that say sharps containers, harm, reduction, here's, safe disposal. Instead, we're like, no, we can't do that. You got people, a restaurant row here, people use needles for insulin. Couldn't they just drop their needles in there? Why is it all about drug users? What about diabetics? We got no diabetics. We tried to align with diabetes associations to get the legislation passed. And so all of that.
So when did that finally come online?
It was 2015, 16 when it finally kind of started making its way through to then be legislated.
But the tipping point was helping out the police.
Sure, any law enforcement, right?
I mean, I don't dispute that. I don't.
No, I'm glad. I love them. Look, some people are against them. I'm not. Every time I call them, they come.
Yeah.
So, and I call them. But it was to protect them from needle sticks.
Sure.
That was what the initial legislation was here. The rest of it, kind of added on, but it was the compromise.
What is the biggest or some of the barriers that your folks that you run into regularly, or still running into maybe?
At WNCAP or in general, or
In general.
you know, because I'm involved in a lot of different communities. You'll see me maybe at some of the shelters. You'll see me at recovery homes. You'll see me at jails and prisons and at schools and other area things. And so everybody's struggling in a certain which way. You know, if it's money, okay, because you can't pay your rent. Okay, you can argue with the tourism board about, making some of that money available to people paying rent. Well, that's not what they're interested in. Or the state doesn't allow them because of the legislation. So we're really not, I think our greatest barrier in the world is to see that we are sharing space and place, this space and place called Earth, that we all are breathing, air. Is it clean? Probably not. We drink water. Everybody needs water.
Sure.
Do you have access to a place to pass water? To have a movement? Do you have a place to use the bathroom and to then even take a shower or wash your socks? Can you access that? And so a lot of people I know, they get very angry. They say, oh, everybody's enabling somebody here in Buncombe County and Asheville and all that because they just give. But then we don't follow through with what else is perhaps needed in the amount that's needed. So the greatest barrier is stigma. Stigma to others, to other human beings. We don't see each other's humanity.
We're not nice people.
If we could take the masks of skin and hair off, we'd find that biologically we're much more similar than we are different. And I don't know, it's bothersome to me around the world, all the things that, I can eat and drink as much as I feel like all day long, but there are places that people don't have today's meal.
Right.
They live on $1 a day and we're yelling at them because they're taking our jobs or something, all that kind of mess.
What's the state, and I've kind of lost track, I remember the HIV cocktails that friends of mine had to ingest.
Awful stuff.
What's medication look like now?
It's excellent. There are what are called single tablet regimens now. Take it on your way to bed. Take it in the morning if you'd rather, but take it on your way to bed and go to sleep. They're much easier to take the medications now. They're usually 2 to 3 chemical combinations, but the side effects are so different. You remember back then, people were so sick. I remember Marty, he'd be vomiting because of the medication. It was just awful. And they had, the buffalo hump from Crixivan and stuff, and just the facial, the lipodystrophy and all that kind of stuff. You don't see that. You don't see the opportunistic infections like you did back in the old days. So these are life-sustaining medications now that actually suppress the viral load of HIV so low that it's called undetectable. This is a laboratory term.
Sure.
But when measured in an undetectable level, even here in North Carolina as of 2018, if you can suppress your viral load to under 200 viral particles in this measurement per ml, you do not have to disclose your HIV status to your sexual partner nor use a condom with your sexual partner, because if you're undetectable, you're untransmittable. U equals U. Look it up. CDC.gov.
I was teaching a class last week, a peer support class, and somebody brought up an ethical, in their mind there was a dilemma, and you just answered it in terms of, are you obligated to tell your partner that even if you're zero load and it's so micro that it doesn't matter?
Not by North Carolina state law. Now every state is different. Every state is different. But in North Carolina in 2018, the laws and the HIV control measures, if you look up North Carolina HIV control measures, you'll see where it describes that. If you're not suppressing your viral load, then the control measures go back to the original, that you must disclose your HIV status. You cannot share needles and sperm and ova and that kind of stuff.
Sure.
But if you are suppressing your viral load, you will not transmit it to your sexual partners.
Okay.
It is not recommended that you would ever share a needle for any reason with anybody.
Never an idea.
Never. So yes, that's important to know. It reduces the stigma, but people always ask that. When I say that, they're like, "No, you better tell me. I want to know." I was like, first of all, when's the last time you were tested?
You were tested.
And then, do you know your partner's status? When's the last time you had sober sex? That's what I ask, because we're so acculturated to think that we have to use alcohol and drugs to talk to each other, to get on the dance floor, and to have sex with each other. I always say, if that's going to be the basis of my relationship with someone, it's not going to work. I already know that. And so,
Gotcha. And this is a temporally a large question in terms of time. What changes have come about, say, that even in the last 10 years, that you've noticed a change in culture or a change in mentality?
Well, I mean, there's been great effort to reduce stigma just nationally. Still, in this country, because every country is different. I go to what's called the International AIDS conferences, and when I go, you get to see people from around the world, and it's just different in every country. And the strains and substrains of HIV are different. There's an HIV-1 and HIV-2. You can look up all this, online. I always suggest that people go to cdc.gov because you can look up under the HIV, and you can see all this information. But in this country, the United States of America, the highest numbers of new HIV infections still occur among people who are men who have sex with other men. Needle use has brought HIV infections down to about 6 to 8%.
Okay.
That's significant. In the early epidemic, it was 33%. It was a third of all HIV infections were related to the inaccessibility to sterile injection equipment. Sharing needles. It was a cultural thing. You shared a needle, you share a joint, or pass around a bottle or whatever. People shared needles. And so by making accessible clean sterile injection equipment, we reduced new HIV infections related to needles down to about 6 to 8%. Depends on what numbers you're looking at and which cities and all that kind of thing.
Who came up with this plan originally?
A lot of people. So there's an argument about whether Dave Purchase was ever the first one. He was out of Tacoma, Washington, and or some of these guys. There's all these names, Alan Clear and folks from Great Britain. You had from folks in Germany and. Where they were really advocating early. They didn't stigmatize HIV quite as much as we did here.
Sure.
We got real puritanical about it, and I'm
as
not
we
one
do,
of those.
as a culture.
Not one of those kind of people. I don't do those nasty things. Yes, you do probably behind closed doors. You just don't tell anybody.
Talk about it.
Right. So, but it took people like that and advocates in the big city who were losing all of their friends.
Sure.
And who themselves had gotten infected by, the inaccessibility to needles or otherwise having to survive on the streets as hard as it is.
So aside from stigma, what's problem number 2 in terms of severity or?
You could arguably say money, funding, and now we're in a time period that there are efforts to reduce and cut millions and millions and millions of dollars in a range of what people call the Ryan White Care Act. If you ever remember Ryan White back in our days, right? He was on Donahue.
Yep.
Nobody remembers Donahue, but he was a show, it was kind of like on Oprah or whatever. But this kid who was a hemophiliac.
Like 7 years old when you're.
Right, and he got a blood transfusion and got HIV.
Right.
But the whole city, the whole state, the whole country, the world, just beat up on him. And finally, in Washington, D.C., they named this bill after him, and this law now is the Ryan White Care Act to take care of people with HIV. So the funding now is a big risk. This PEPFAR that President George W. Bush put into place that helps people around the world in collaboration with people like Elton John and the Clinton Foundation and Bill Gates and Melinda Gates, Foundation, all their money that's helping to put up clinics in poor, I don't call it, it's not third world. They're low income, middle income, or high income countries. We're the highest income country. But so in low income countries where they didn't have a clinic, couldn't get to a doctor, needed transportation, didn't have access to the medication or even testing sometimes, these are the things that we were able to put into place because we're so rich. And so everybody's screaming about, we're giving away all this money or whatever, and it's just not. That's a big barrier.
Who were the have-nots still? In terms of geographical location?
Geographically?
I'm not saying economically, I'm saying...
Yeah.
Would it be Africa?
No. Well, worldwide, yes. Okay. Sub-Saharan Africa, yes. But any geographically impoverished part of the world, yes. That's where major efforts are needed. But in this country, in the United States of America, if you look at AIDSView, it's aidsvu.org, they will show you this map that the southeastern region of the United States still has more people living with HIV, more new infections of HIV, fewer resources, because we're very rural. We're very restrictive of, who we give what to and all that kind of stuff. But if you look, it is the southeastern region that leads the way in new HIV infections, in, STIs, sexually transmitted infections, where you have transportation issues, poverty, whatever, food insecurity, all of it. So that who lives in the southeastern region,
How quick did you guys respond to Helene's aftermath in terms of what happened with that?
it was very scary at the time. Our building did not get damaged. We were high enough up from the water. But anybody that had access to phones, and you remember there was no phone service. It was really hard to find access. So people were calling around, first of all, to each other in the agency. And then, do you have your list of all your clients? Try reaching out to them. If you have access, try that. I think, if I recall correctly, we lost 2 clients. One actually during the time had died. It wasn't because of Helene, but they were sick and they died. And I believe one client, if I'm correct, was involved in the flooding. But that was it in terms of who was impacted like that. But, we tried to do what we could to make sure that we were collaborating with Loving Food Resources to make sure people were still having access to food. Or if you could get out, could you bring food out to them if they couldn't get in because public transit wasn't working necessarily, and it was very hard to get through Kenilworth. That's where Loving Food Resources is. Trees were down, and phone lines across and all that. It was a mess.
Yeah.
So we were impacted like that, like everybody, but tried to jump in as fast as we could like that.
Aside from Loving
Food Resources,
right? I know them.
LFR, we call it.
Off the top of my head. Who are your other community partners?
Well, obviously Sunrise, because we have a space
I don't count
here with you.
Those folks.
Right. But we collaborate with any and everybody. I mean, obviously Mayhec, right? And we do trainings for a lot of the agencies. So I say ADACT, Alcohol and Drug Treatment Center in Black Mountain, and First at Blue Ridge, and Crestview, and Western Carolina Treatment Center, and just name any of them. And then when you go west, I can't even name all the places out there that people like who are Jacqueline and Charlie are going out, and maybe Claudia are out there in the community and working with people all the way across the counties.
Are you finding warmer receptions now in some of the places that maybe weren't so much?
For the most part, if it's a rural community, sometimes they're a little bit perplexed by things that we talk about or things that we might suggest or want to do, including harm reduction, including Narcan, including condom demonstrations, including needle exchange and syringes.
It's the first time I remember seeing you, and I forget where you were at. It might have been Four Circles Recovery.
Yeah.
A long time ago, and you did your
condom demonstration.
Yes.
Did I?
Everybody talked about it.
Oh my goodness.
In a good way.
It does happen sometimes.
How do people get connected with WNCAP?
So people know that I don't have a cell phone or I'm not very technological. But if you look up the Western North Carolina AIDS Project, WNCAP.org is the website. Yep. You'll see all of the ways of reaching us throughout the counties. But it has a whole list of who's on staff and who are the board members and how to reach those folks by phone number or if there's an email address. We are glad to serve anybody and go anywhere that we're invited to go. I'm always excited to be invited back the second time. The first time is okay, but sometimes my mouth gets me in trouble. So if you invite me, back the second time, I'm doing pretty good.
Yeah.
But really, anybody can come to the syringe services programs. We don't ask a lot of questions. We ask, some of the identifiers, unique identifiers, so that if somebody needed to prove that they actually were a participant with us, that we actually have whatever it is that the code is.
Gotcha.
And people with HIV can be served for the case management services, prevention education, obviously anybody. We have about 40 or so places where we drop off condoms. I call them day and night shifts, so some of the coffee shops and barber shops and salons and agencies and nightclubs and things like that. But if people are having a party and they need a bag of condoms, call us, contact us, and
Gotcha.
I'm glad that you have a summer party or something like that.
Okay. Let me take a quick break here and do my mandatory
Oh yes,
PSAs.
of course. Sorry.
So again, Sunrise Community is partnering with 103.3 FM. We've been doing it for about a year and a half now. This podcast. So Sunrise Community for Recovery and Wellness is a nonprofit staffed entirely by certified peer support specialists, 100%, or people who are going to be it very soon. And we utilize lived experience to provide authentic peer support, which that's a whole show in itself, versus intentional, versus resource navigation and education. And speaking of education, What do we have? We have 5 minutes left. Where did the time go?
Where's the time gone? We just started.
Okay. What questions would you ask the community? Switch roles here and say, okay, what needs to be asked that we're not asking?
Well, so here are some things I would like to say. First, environmentally, I think that we should really check ourselves environmentally. And that includes providing not just trash cans downtown, but also places to change the culture of people's need to dispose of sharps. And I don't care if it's a pipe or a needle or something, but that it be disposed of properly.
Sure.
You can take your sharps to the county transit center, but transfer center, but not every county does the same thing. It's not centralized in the concept in the state's mind how to dispose of
Who
needles.
picks them up?
Well, people do. You can Sunrise. I think you can call Sunrise. You can call WNCAP and say, I
mean,
see
the
some
boxes.
needles. But that's an issue. Who does pick them up? Maybe you all do. I know the Steady Collective had some certain places that they used to do, and I know that when people bring their bottles back, or the containers filled with needles, we then transfer them over to what's called the transfer station, the county transfer station,
Okay.
where they are then disposed of by, I think it's called Carolina Biologics or something is the contract. But we don't have enough of that. But in terms of what else? I think we need to have shower stalls like we had during Helene, that we have shower stalls and toilets in major, lined up somewhere.
Yeah.
And I almost think that we probably, people like tents, they like to be outside. Not everybody wants to be inside or housed. I get that. But where is a safe ground where people can have a tent? They know they can go to the restroom. They have a trash can, because that seems to be the complaint that I hear. Oh, they're so trashy and there's so much and can't clean up and all this kind of stuff. I almost want to cuss. I'm sorry, I almost did. But, give me some place to throw my trash.
Sure.
Make it easier for me. If I need to live outside, want to live outside, it's okay. We've talked about over the years, a wet house. Is that okay or not okay? I don't know. Sometimes people are like, that's not cool. That sounds like you're promoting alcohol use. Well, if we're not Beer City something promoting
a wet
alcohol
house
use,
is
a wet house is that you can sit there and be drinking all day long, but it is an environment that is kind of maybe out of the eye of the community.
Okay.
But it would be inside or outside, it's okay. That if you want to stay drunk all day, that's your business, not mine. I don't.
Sure.
But that's considered what they call a wet house, and it has been experimented with. And I don't, good or bad, I don't know.
I've never heard it for alcohol, honestly.
If you want to use drugs, can I stop you? I can't stop you. But if you're in the middle of the street and it's bothering our tourists and our leadership and the business owners and the homeowners, well, then give me a place where I can until I meet one of the peers. Until I find the way into detox, until I am ready to make my changes. I don't know. People think I'm controversial about it, but I don't know what to say. If you don't want to stop, I can't stop you. I can't legislate it. I can't put you in jail and think that when you come out, you're not going to firstly think of either having sex or going to do drugs. So people need to decide, what do we do to reduce harm and change our mentality about the use of alcohol, drugs, and disposal and public health and all of those things.
Are you bringing up adverse childhood experiences as part of your program now?
No.
Nobody talks about it?
No, I mean, I wouldn't say so. I didn't have the experiences. Look, if I can, and you can't see me on the radio, but if I could give this much back, it's less than an inch that I've got my fingers together. If I could give this much back of all the good I've had in the world would change dramatically.
Okay.
And I can't even give that much back of the good I've experienced in the world. It's unfair to me that people are struggling as they do, that they're faced with the barriers that they are, that they have the trauma. How does the human, race even survive with all the stuff around the world?
So you've been doing this. I came up to Asheville regularly after 2005, and I remember meeting you somewhere around town. And I'm like, what's he do? It's like, oh, he's harm reduction. I'm like, what's that all about? This is even before I even entered the fray, and I'm just amazed that you're still doing it. It's amazing, your energy.
I've grayed out and I'm a little wrinkly now, but
you hear that, everyone? Okay, just
what happens over the years?
Your places that you go to do outreach, are they like church basements, or where do you meet people to educate them that may be friendly, may not be friendly?
Really, anywhere. I'm not afraid to speak to anybody or to meet somebody or to go in any environment.
Okay.
I'm not being naive. I know there are risks, but I'm not afraid. You take me in, you want me there, I'm in. So yes, I've been to churches. I have to change my language a little bit.
Okay.
But when I'm in a place, the prison, maybe I'm not. I'm a little bit wide open, maybe. I speak the parlance of the community I serve.
Mm-hmm.
And so if the words I say offend you, like I just did a training down at Pavilion down in Polk County last week, a 3-hour CEU
At
training. It's
Okay.
on that side of Polk County.
Uh-huh.
And so these were the CEUs for the trained professionals. They required 3 hours
Sure.
every year. And one of the comments in the evaluation was, he was a little bit too vulgar for this environment.
What environment? A rehab environment?
And they were counselors. They were counselors. And then the other part said, this felt like a sex ed class instead of HIV class. And I was like, what are you talking about? You know what I mean? Like that, but I can't say anything to anybody. That was an anonymous evaluation. But the rest of them were like, wow, this is really cool. That's something different. I never heard of that. I was shocked to hear it, or, I didn't think that was still an issue.
I have a zillion more questions, honestly. I didn't even
We
get
need
my
to do this
second
again.
page.
I'm sorry. We need to do this again
Yeah,
sometime.
let's not put the lid on it, but let's end on an upbeat note. There, like, what do you see promising for the near future?
I look out my window every morning when my eyes open, and I see the squirrels and the birds looking back at me like, where's my seeds? You come on out there. So I start my day in the most positive way.
Wow.
And I end my day in the most positive way. I don't want to hear the news. I don't want to hear your complaints.
Yep.
I don't want to hear. So all day long, I'm involved with people, and it can be frenetic.
Uh-huh.
And it can be challenging, but I find such a peace in every single day, in the breaths that I take. I am at peace. I truly am.
Uh-huh.
I can complain and I can vent like another human being.
Sure.
But I find something positive. If you can't find something positive every day,
Mm-hmm.
look out at the clouds. Look at something in the tree. Find a delicious smelling iris or rose bush to smell. Take the time to find something positive.
Literally smell the roses.
I love them. Have you smelled irises? The purple ones smell like purple. The yellow ones smell like yellow.
All right. Well, please come back soon. We'll figure this out over the next
I love
couple
you
of
all.
months.
Thank you to
Thank
Sunrise
you.
so much for all that you're doing. I really, I'm so happy to be around you and all the peers, and I'm finding people too that
Speaking
I
of
haven't
which,
seen in a while.
WNCAP is here at Sunrise, 209 to South Tunnel Road every day.
Monday through
mostly.
Friday. Yeah.
Yeah.
You guys don't work weekends.
And
what?
I wish we could.
Who doesn't?
Thank you very much. This is Michael Harney. We've been speaking with, I'm Kevin Mahoney from Sunrise, and look to speak to you again the second Tuesday of next month. Thank you very much.
Thank you.
Great being with you. Thanks.